Now, it seems each day there's a new bit of diet advice which might actually contradict the day before, but a new book hopes to dispel all those myths and lay out a simple 21-day plan. It's a book by Dr. Asim Malhotra, who joins us this evening. He's a cardiologist and founding member of Public Health Collaboration. His book is Pioppi, I hope I've said that right, Pioppi Diet.
That's correct,
and it's all based on a kind of fishing village in Italy. So just tell us, how did you sort of stumble across this then?
Well, this is now regarded as probably the world's healthiest village. So this is a tiny village about an hour and a half south of Naples in southern Italy, where the average life expectancy there still for men and women is around 90 years old. And many people live to over 100, but they age well, they're very healthy. And the origins of how this village comes into the book is really based upon a scientist called Ansel Keys, an American scientist, who's probably the most influential man in nutrition and medicine in some ways, because his work, his research, was responsible for changing dietary guidelines in the late 70s in the USA and in the early 80s in the UK, essentially demonizing fat and cholesterol. And he spent a lot of his time doing research in this village. So what we did, myself and my co-author, who's a former international athlete, Donald O'Neill, is we went to this village to try and discover the secrets. And what we've done in the book to produce this 21-day lifestyle plan is bring together all the cutting-edge, latest medical research around diet and exercise to cut through a lot of myths that exist currently, and actually the myths that are the misinformation, if you like, that's driving the epidemic of obesity and type 2 diabetes. So, for example, this fear of fat that we've had for many years, actually, if you cut out sugar and what we call refined carbohydrate foods from your diet, you know, eating fat is about as likely to make you fat as eating green vegetables to turn you green. Saturated fat, people think clogs the arteries. Well, that's incorrect. As a cardiologist, I can say that with a hand on my heart, that eating foods like butter and cheese and eggs and that kind of thing does not clog your arteries. In fact, can be very nutritious and beneficial for you. So there's lots of information in this book that can help people very quickly, actually, improve their health markers within a few weeks. And if this was to be adopted, you know, across the population, the former Secretary of State for Health, Andy Burnham, has actually said this has a power to make millions of people healthier and happier and sustain the NHS.
So why is it the Mediterranean diet on a whole has always been thought of quite positively? Why do you think and hope that this version of it will catch on, I guess?
Well, I think the Mediterranean diet has been misinterpreted, and there are lots of components that we know are beneficial for health. So, for example, foods like olive oil, which I consider almost like a medicine in the way it acts on the body in treating and preventing heart disease and many other conditions, a handful of nuts every day. The problem has happened, Alex, is that we've put lots of starchy carbohydrates, the breads, the pastas, the potatoes, at the base of the food pyramid. And when you look at the data over the last 3 decades, the increase in overall calorie consumption has come from these foods. And that actually is incorrect in terms of what the true Mediterranean diet was. It was also more of a lifestyle. And I think what we need to do is kind of wind back from those harms and that misinformation and bring all the science together. The other thing to mention is type 2 diabetes, which is probably one of the single biggest costs to the NHS as one condition. You know, this is a condition of carbohydrate intolerance. So those sorts of foods, the sort of white starchy or the sugary foods, are the kind of foods that people with type 2 diabetes should be avoiding or cutting out considerably. So, you know, and I can speak from clinical experience as a qualified doctor for more than 15 years, but I see patients all the time that they come to me, and having followed the advice that I tell them, they're able to come off medications even for type 2 diabetes, even blood pressure. So this stuff works, and I think it's really important now, and especially with the situation we have, the public health crisis that we have, that we get this information out to people and they can try it and they can read the science and understand it properly, and then hopefully we have a brighter future for the population health and for the NHS.
Okay, Dr. Asim, thank you so much for joining us this evening.